Hi ladies, it's Rachel, a doula with Imagine If Childbirth Services. And yes, these are my two little kitten friends. They're here to talk to us a little bit about what we're going to talk about today. This is video 1 of the newborn series. And by the way, if you want one of these kittens, we are also giving them away for free, so please let me know. But today we're going to be talking about kangaroo care, or it is often called skin to skin. But first, before we get into the actual instruction, we're going to have a cat or a pop quiz, whichever you call it. So get ready. So here is the question. Right at the moment after you've pushed so hard and your baby is finally out, what are you supposed to do? Okay, so remember the question was, what are you supposed to do right after you've pushed out that baby? So, A, are you supposed to flop like a rag doll and just lay there while the doctor holds your baby or the midwife because you're so absolutely exhausted? B, do you immediately pull up your shirt and put your baby against your belly and just love it and say, I'm so happy you're here. I'm so happy you're here. C, do you grab the baby and start jumping up and down because you're so excited that this baby just came to the earth? Okay, so I understand that a lot of moms feel like doing A because labor is just that. It is labor intensive. And you would be a superwoman if you did C. I would be very impressed, but I've never seen that before. Even though we feel like doing that and we're so happy, I can't imagine jumping around and doing a happy dance. So the correct answer is B. Yes, if you have clothes on still, you lift it up as much as you can and you grab that baby and you hold that baby against your skin as much as you can. And we will talk a lot more about this. So once baby is on you, skin to skin, right after baby comes out, then you can take some blankets and cover up baby like this. But there should never ever be anything between your skin and the baby's skin. They should be next to each other, right like this, with no cloth or no fabric, and then the blanket can be on top warming. You can put the blanket, a little bit on the baby's head or put a light cap there, but always the baby's skin should be against your skin. Now, sometimes doctors are not completely trained in this, and they will think, oh, well, since I have baby anyway in my hands, I'll weigh the baby or suction the baby, or I need to dry off the baby, but none of that needs to be done off of your skin. The very, very, very first thing is if the doctor does not give you your baby, you take your baby and you put baby on your skin, cover the baby up. Everything that needs to be done for the baby can completely be done on your belly, skin to skin. So if the doctor feels like he needs to suction baby, that can be done right here on your belly. If baby needs to be rubbed a little bit to help cry, even if baby is blue, we'll talk about that more. Baby should always be skin to skin, and then anything the doctor feels like he needs to do can be done on your belly. Now, of course, it's a little bit different if it is a C-section, but that's what dad is for, or mom or cousin or anyone else who is going to be outside of the theater. So right after they take out the baby, they will probably wrap the baby in a blanket, and you can instruct whoever will be with you at the outside of the theater at the birth to unwrap all the blankets And they should be prepared to lift up their shirt, put baby skin to skin, put the blankets that the baby will already be in over, and possibly cover up the head so that baby is skin to skin. So there are many benefits of skin to skin, and it's really important that you have skin to skin for at least the first 1 to 2 hours. Now, sometimes when you have stitches, that's not completely possible, but the baby needs to be skin to skin with someone. So sometimes, if you're laying down having the stitches, you can, pull your clothes up or have your skin exposed on the side while your husband or someone else kind of lays next to you, or you can just have whoever's with you there at the birth hold the baby skin to skin while you're having stitches, and then immediately give the baby back to you. But studies have proven that the medical studies absolutely prove that the best skin to skin is number 1, mom, and number 2, dad, and then number 3, any skin to skin is great. So you want to have it at least for the first 1 to 2, possibly 4 hours. And then after that, every single time that you nurse, you should always have the baby skin to skin. So when you're nursing, you need to make sure that you are wearing clothes, and especially that you take clothes to the hospital that open in the front, or it's just a top and a skirt, not a complete dress, that you don't feel comfortable with hiking all the way up, because you'll want to lift up your clothes completely above your breasts and then have baby naked. It's okay if the baby has a diaper on and, as we said, a cap, but besides that, baby's skin should just wrap all around you, and you really should nurse like this, of course, absolutely, the first 2 to 3 weeks. And then as much as possible after that. If you guys are at home, then you should take your clothes off on the top. Baby's clothes should, at least the top, should be taken off. And then if baby is cold at all, if it's cold weather, then you can put a blanket over baby. So this is going to be the absolute best way to nurse. Also, if you are just hanging out around home and you're not sleeping, so you don't have to lay there and try to get the baby skin to skin and then try to sleep, that is going to be less effective for your sleeping, and you want to get as much rest as you possibly can. But if you're just hanging out at home, nobody else is there, you're okay, pull your shirt up and just hold baby skin to skin as much as you, of course, you want baby's face to be up. If the baby's not nursing, but hold baby as much as you can, skin to skin during that first week. So in the newborn series, this was video 1, all about what is skin to skin or kangaroo care, when should you do it, and our next video is going to tell why it's so important and all the amazing benefits. So be sure to do kangaroo care, lift up your shirt, be skin to skin, and love those babies.